Hi, everyone. How are you? I just want to take a second to explain why I do this. I do this because I want to inform and educate as many men and as many women as I can to the fact that sexual function is an indicator of health. I want you to know that your sexual function is so important that you need to pay attention to it and make sure that you are having excellent sex with your partner. When you have sex with your partner and you have issues, please see a doctor that practices sexual medicine or can treat erectile dysfunction or orgasms for women dysfunction so that you'll be able to address issues that might be underlying somewhere else, like in the heart, right? In the sugar, in the blood pressure. It could be anything going on affecting your sexual function. So please understand, my game plan is to educate you about sex and how it can affect your health. Like I said before, greater sex, greater health, greater health, greater sex. If you have at least 2 orgasms a week, you live longer. 2 orgasms a week and you live longer. And people are not having sex. People are actually living sexless lives, married and unmarried. And I try to emphasize the fact that you need to have safe sex, consensual sex, and, understand that it's not a sin. It's not a bad thing to have sex. Even though I know I'm in the South, I know it's taboo, depending on how you grew up. The more conservative you are, the more religious you are, the more apprehension you have about sex. But understand that sex is natural. It was given to us to use, to enjoy, to procreate, and as you get older, to find a partner that you'll have a nice time with. So please understand, it's only to educate you. I only do this to inform you so that you have better chances in the bedroom of having that orgasm. You have better chances in the bedroom of having a nice time. But if you don't make that effort of learning about sex, learning about how to please your partner, you're not going to have a great time. So I implore you, if this is not for you, no need to watch. I did get some comments. I did get some not nice comments, but I want you to, like, comment, send me, questions, because I want to continue doing this to give you the information that I don't think people will give you in a routine medical office, right? So I'm giving it to you for you to use and for you to know that sex is connected to your health. All right, so let's get some great sex so we know your health is great too. All right, over to the topic. All right, so we have the male reproductive sexual anatomy, right? The reason why I put that there is that we're going to talk about some erogenous zones in our men. Our men are suffering in silence. We women do not know their erogenous zones. Now, some women do, but I'm saying that the majority of us do not know their erogenous zones. So we've got to get familiar with their erogenous zones. And I want to give you a few ideas. We did talk about some of them, was it yesterday or the day before? And there was one I missed out. Oh my goodness. I'm so embarrassed to say that I missed out the lips, the kissing, the most sensual, the most erotic, the most powerful, as far as I'm concerned, the most powerful sex organ, right? Because the lips have so many things that it can do. I'm telling you, it can lower blood pressure, all right? It can make you relax. It can make you, your immune system stronger. So many benefits. One day I'll talk about that. But today I just want you to know I forgot to talk about kissing the lips as an erogenous zone. You've got to kiss the lips. You've got to make sure your partner is very satisfied with your kissing. And if you need to practice, you practice. If you need to do research and find out what you can do to improve your sexual kissing, because it's very, very sensual. But that's just a note. Don't forget, kissing is important. But today I want to talk about men. And men love kissing, right? Women love kissing. I think if one can actually know that when you don't kiss, you're missing out on a crucial sexual activity that is obviously probably transactional or business wise, which is why they're not kissing. I would prefer if you have a partner, but I understand circumstances for people, they don't have partners, so the rules apply in those situations. But my encouraging words would be please find a lovely partner. Go on the dating apps, get out there and network and meet someone that you will be able to partner with. And take your time, be positive, take care of yourself, because you know you draw what you attract, right? You attract what you are. You draw in people that are going to be what you are. So try and be the best that you can be so that you can be drawing in great people, all right, as partners. Okay, so the kissing was what I omitted. So for men, they love to kiss. So I'm not, again, going to go into how to kiss. These are things I want you to research, for one. Two, each person's kiss is different. What someone wants from a kiss or what someone does in a kiss, some might like it, some might not. So always talk to your partner, try something, they don't like it, try something else until you get what the person likes. But again, kissing is something crucial. All right, so let's go back to men. Men, I did, like I said, cover some erogenous zones last time. I'm going to cover a few more because there are very few studies for men that talk about their erogenous zones. I went looking for studies and barely any. I did see some articles. If you want the articles, let me know. I can send them to you. The actual fact is that, you know, again, men vary, and you got to know your man. You got to know what they want in terms of, you know, touching. The idea of asking before is not a bad idea. Just talk before you even have sex, over a cup of coffee or at dinner or out having some drinks. Just talk about what areas they like to have fondled or touched. But it's important for you to know that, you know, each person will have their own preferences. Okay. Now, I'm going to go through some of the ones that they actually do like a little bit more in terms of touch and stimulating. According to some of the articles I read, the areas I'm going to mention are just a few that I didn't go into depth when I spoke with you guys last few days ago. So I'm going to go and mention a few again, and I'm not going to go into the stimulation itself, how you stimulate, but I'm going to talk about the areas, and then I'm going to focus on the male genitalia. I'll give you some clues though. When you are touching, okay, or stimulating someone, again, there are many ways to do that. Again, the simplest one we talked about is touch, right? When you touch someone lightly versus a heavy pressure, right? So depending on what you're trying to elicit, you're trying to decide what format of touch or stimulation you're going to use. But apart from touch, we have, again, the lips, right? You can kiss the areas that I'm going to mention. And even the ones I mentioned yesterday or the day before, you can kiss those areas. You can blow on those areas. So each of these erogenous zones, both in men and women, you can kiss on these areas. You can nibble on those areas. Okay, so we're talking about nibbling, kissing, blowing. We have, again, we talked about touching. You can actually sometimes squeeze, sometimes bite very gently. You can use toys. ASMR is something that some people like to do. You can do ASMR when you're talking about the ears. There are so many other ways. Toys, right? Again, you can come up with very creative ideas. Ice, right? Cubes of ice. Some people use wax, right? Some people use candle wax. And again, you know, there are other toys like little whips, little light whips, or the little toys that you can use for vibrating, you know, vibration. So it really matters between the two of you. So getting consent, getting that safe word is going to be the most important thing to do. Talking about whether he wants to do it, you've got to find out, because a lot of guys are shy. All right. So let's talk about the male erogenous zones. Okay. First of all, the scalp. The scalp, especially if they're bald, I think they're going to love you touching them or kissing them, right? So, again, the scalp is an area for men that really love to be awakened. Remember, erogenous zones are areas on the skin when stimulated causes a sexual response, a sexual arousal. Remember, that's what we're trying to do here. And the more chances of you getting a sexual arousal, the more involved the person will be, the better the orgasm. In the end, we hope and pray, right? The touching of the scalp can be, again, little kisses. And again, I don't want to go into details of what to do. You guys should come up with those on your own. But these are areas I want you to focus on. Again, find out what the person likes when you try them. Okay. Then we have the nape of the neck. Again, men like the nape of the neck. I know when they go to the barber, they're not thinking about that. But in the bedroom with their partner, the nape of the neck is very, very sensual for them. Then the ears, right? The earlobes. If you nibble on the earlobes, I know I'm going to do that sometimes, tell you what to do, but no, I want you to just know there are things you can do to the earlobes, right? Then we can go to I said scalp, back of the neck, earlobes, and go to the armpits. Now, the armpits actually are areas where your pheromones or where their pheromones come out. So if you like their pheromones, which I do, their pheromones are the natural hormones that will contribute to the sexual arousal in women, especially if you're with a woman. So if the guy's with a woman, she's going to love it. But I know it's strange, right, to lift up your arm and then start stroking and doing things to the armpits. But I do believe because it's never done or it's rarely done, I think you're going to have a great response to stimulation of that area. Again, pheromones can be produced, and those pheromones actually help with fertility, right? So if she's getting a lot of those pheromones, if you want to get pregnant, only with permission, that would be a nice way of getting her in the mood by going under your armpit and she stroking it, doing whatever she's doing to stimulate it, and then getting that smell to help with fertility, to help her with relaxation, and actually help reduce tension in her, which is studies have shown that. Okay. Then you have the nipples. Some men don't like the nipples being touched, so be aware of it. The areola, the nipples. You can do anything you want to it, again, with consent. The clamps are a little bit too much for most people that are not aware of it. But people that like more pain will try and go into that area of BDSM, which we're not talking about right now. But if you do choose to do that, go for it. Use a safe word. You know the rules, those of you that are engaging in that. So that's okay. The other area is going to be let's go between the belly button and the navel and the pubic area. So that's the lower stomach. I think guys like that. Teasing them before you get down further is a great area to do some stimulation. Okay. The lower back. Okay. The lower back. Again, guys that have some pain, I think they'll love a great massage there, right? But again, there are certain things you can do to the back to stimulate them. And again, there are some articles that show that this is an area that they like to have touched. Massage, of course, you can do whatever massage you want to do, but again, focus on these areas and find out whether your partner likes them. One thing that I didn't talk in detail about was the inner thigh, and we women love the inner thigh, but the men do too. And I don't know whether even allowing women to get access into that particular part of the body, but it's the inner upper thigh. And they say there's a nerve that connects the inner upper thigh to the base of the penis and to the upper, let's say the upper third of the shaft, okay? So the shaft and the scrotum actually get some stimulation and some feelings when you're stroking or when you're stimulating the inner thigh. Okay, I'll say that again. When you're stimulating the inner thigh, they actually get some sensation in the upper third of the penis, right, the shaft, and in the upper part of the scrotum. So there's a weird connection because the nerve supplies that area, and you'll be able to get your response by doing that, and he probably will love it, right? All right, then I think that is the areas that I wanted to cover. Of course, we know I mentioned yesterday or the day before the buttocks and the back of the knee and I said fingers and toes. So these are things you can go ahead and suggest to your partner and see whether he likes it or not. If he doesn't like it, stay away. If he likes it, go for it. All right, over to the diagram. I hope you can see this diagram. Okay. So this diagram, it says male reproductive system anatomy. I got it from Anatomy Stuff, and they have a website that you can check more information on, and they have an Instagram on there. I hope you can see that. If you can't, let me know. I can send the information to you. All right, so here we have a simple picture of the male genitalia. We've cut the body in half, same thing like I did with the woman. We cut the body in half, and this is going to give you a picture of the organs cut in half too. All right? All right, let's start with the obvious male organ that they love, the penis. That's the penis right here. And the penis has the glands, which is the head of the penis. The head of the penis is a great area. It has 4,000 nerves. Now, we beat the glands of the penis by having 10,000 in our own glands of our clitoris. And that reminds me, I think I said bulb of the clitoris sometime yesterday. I don't know how I was getting bulb in my mouth, but the tip of the clitoris is the glands also. So it's very similar. If you look at the clitoris and look at the penis, and maybe I'll do that later on, I've done that before, there are some similarities that you can see. So heading back to the head of the penis, we have the glands that has about 4,000 nerves, okay? And they love that to be stimulated. So please understand, whatever you want to do, stimulate that area. It's going to help their erectile function, and it's going to help them have that orgasm or that ejaculation that will make it more intense when you do some of these stimulations, okay? In that same area is the foreskin. So the foreskin is for those that have not been circumcised, all right? So the uncircumcised will have that foreskin. That can be a sense of pleasure for them. And I know that they are normal people, just they might have different areas of erogenous zones. So again, you find out by asking and playing with it and seeing what they prefer. Now, at the back of the penis is the frenulum, and that frenulum is where the shaft and the skin of the foreskin was. So those that are circumcised, it's been removed. So there's a little tissue left there, and that can be very, very highly sensitive for men. So you want to focus on that area also. Stimulating that area will get them going. So try and understand how to stimulate them by finding out and communicating. Now, the underside of the penis also is very, very sensitive. So the things you can do there, plenty ideas. Don't overdo it. It's a very sensitive area. Talk, find out whether it works. He should respond by giving you some noises, some moaning noises, and you'll be able to know whether you're doing it right or wrong. So remember the underside of the penis. Then we have the scrotum, which has the testicles, right? I don't think I mentioned it yesterday either, so I'm mentioning it again for the men and the women. You all need to know, we both need to know, men and women, that these areas are crucial. These are the ding, 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 the big ding, ding, ding. They're the ones that are very important, but these are the ones that you want to become more familiar with and activate them by doing different things at different times, okay? So the scrotum is very sensitive for men, and the testicles are very sensitive. You want to be gentle, right? You don't want to be too harsh. They will tell you if you're too harsh, so just be, aware of that. But one thing I want to mention is there is a seam in the middle of the scrotum, and that is right here. We can't really see it because we have the body cut in half, but this seam is like a little divided part between the two sides, left and right. That is called the raphe, and I understand that raphe is very sensitive. So that's another erogenous zone that we really don't think about in the throes of our passion. But now I want you to think about it, ask your partner, see whether he minds, and find out whether that area right there is something that he likes to be stimulated. Okay? All right, moving backwards over here, we have the perineum. The perineum is between the anus and the scrotum right here. Again, very sensitive. You can use all sorts of different stimulation or stimuli that will help him depending on the time of the sexual act and what is going on. Again, get permission. If he doesn't like it, you stop. Moving back forward, we have the anus. We don't want to miss the anus. The anus is for some and not for everyone. Okay, so again, get permission. I don't want to breeze over it, but I know it's a sensitive topic for men, and I wish it wasn't because it has so many nerve endings there, and it's a very pleasurable experience for men that enjoy it. But remember, I said it, I think yesterday or the day before, that you are not gay if you like the anal area to be stimulated. You are not gay. Please stop saying people are gay if they like to have the anus. I'm talking about men. If they like to have the anus stimulated. You are only gay when you are turned on by another man. A man and man turned on, they get hot in the loins, they get sweaty, and they see a man, man to man. But when you do that with a woman, if you're playing with the areas here that I'm mentioning, and you're with a woman, it is highly exciting and highly stimulating for the man by their partner. So just remember, ask to see how far you can go. All right, last but not the least is my beautiful prostate. Now, as a physician, I talk about the prostate almost every day with my men. I do prostate exams all the time. And unfortunately, some of them are not good. So I hope you men that are listening, and I hope the women that have men are forcing their men to get prostate exams. If there's one thing I will beg of you, blood pressure check, number one. Number two will be the prostate exams. This is the prostate right here, this little walnut underneath the bladder. This is the bladder. This is the rectum, all right? So this little walnut right here can cause horrible problems. And so the first sign you see is dribbling. If a man is urinating and he's dribbling or he's urinating a lot, getting up to go to the bathroom a lot, there's a problem with the prostate, most likely. Get him checked. Make sure that he has the rectal exam part of the check and the blood test part of the check. There's two parts, the blood test and the rectal exam. If you don't want to get the rectal exam, do whatever you can, women, to get him to get the rectal exam, because it's the rectal exam that will tell us the size of the prostate, whether it's too big and whether it's bumpy and whether it's too tender, painful. So again, the rectal exam is very important. I don't mind who does it, the male doing the rectal exam on a male or a female doing the rectal exam on a male. It doesn't matter. Just get it done and make sure it's done properly. If they go in and out, it wasn't done properly. They've got to go in and feel and make sure it is the proper size, or make sure that it's not irregular. And it takes a few seconds. It doesn't take much. And men are refusing to do this. I beg of you, men, please get the prostate examined. It can save your life. Because you know what? If this prostate is a problem and they remove it, you cannot have sex. All right? I'll say it again. I mean, regular sex. You'll have to use a prosthesis. They're going to have to put a rod in the penis to get you to have sex. And then you're going to pump it up or press a button for it to go up. You don't want to do that. You want to be able to get to this problem before it becomes an issue, before they remove it. All right? And that's what we do. Primary care doctors, like myself, are very, very preventive, and we're very, very particular. That prostate, men, get it checked. Women, make sure the men are getting checked. Do not stop until they do. And the age, I have guys 35 that have issues, even 30 that have issues. But remember, the job is to send them to either a urologist, and they do this very well, or to a primary care doctor that will now send them to urologist if there's a problem. Now, I don't send all my patients to urologists. I get an MRI. So just heads up, get an MRI before they do any biopsies, please, because that biopsy is pretty invasive and can be pretty traumatic, okay? So I'm not selling you in gold any treatments or anything like that. I'm just recommending that you ask your doctor to get an MRI before the invasive biopsy. And I hope that I'm not saying or crossing any lines, but it sometimes will tell you whether they see something, and they can use the MRI sometimes to guide them as to where they're going to go. Sometimes, not all of them. I have only one doctor that I use that does that, but it's important to, again, stress and emphasize for them to get that prostate exam, okay? And I believe that is it. The last organ, which is actually the most important one, can be stimulated by going up into the anal area or by going through the perineum right here without going up into the anal area. You can go through the perineum with certain toys, with certain pressures. Again, that's a discussion for you and your partner. Your partner might not want to do anything in that area, and I respect that. You should respect that. We should all respect that. But remember, men need attention too, just like we do. And I think you'll get great results if you focus on some of these areas with the different types of stimulation. Okay, guys? All right. That's me for today. Good talking to you. I shall see you. If not tomorrow, I'll see you soon. Okay? Take care. Bye.